this is important, Ryan. I mean, you put that patch on, didn't you? After not using it for a while, and what happened? I mean, you went into full-blown withdrawals.
It's really a tricky one to answer because, yeah, I hadn't worn the patches for a while. I basically had a sort of an injury after falling. So I applied a patch to use alongside my medical cannabis. And still taking dihydrocodeine and morphine. Yeah.
Well, I remember you ringing me. You were in agony. As far as I was concerned, you looked like you weren't having any pain meds at all. You were in agony, and you looked really rough. I thought it was another medication that we were talking about. It's quite complicated, but looking back now, I know you might be a different opinion, but I'm absolutely certain you were in full-blown opioid withdrawal. Well, not full-blown, but quite severe opioid withdrawals. Certainly it wasn't helping you taking the buprenorphine. You've stopped taking the buprenorphine. You seem much better now.
Yeah, so obviously on the NICE website, anything over 8 milligrams of buprenorphine can affect your opioids. You know, that will be in the link below. So please do feel free to do your own research. And you know, we're asking the question, we're not giving any answers, so that's important. And it's really important that if you are a healthcare worker, we'd love to hear from your, you know, findings and investigation in reference to Subutex buprenorphine.
I think that's the interesting thing, though, is because we have heard from health professionals, haven't we? And not all health professionals agree. So this is a very hot topic between healthcare professionals, and it's a complex one. I mean, buprenorphine, 100%. I've always known that as Subutex. And that was a blocker. I know I nearly killed myself on Subutex because it was given to me when I was on too many opioids and methadone to be given it, and I shouldn't have been given it back then. But I've also been given buprenorphine patches as pain because that was a past life 14 years ago. So I've taken buprenorphine patches because I didn't want to end up on opioids, ironically enough, but they didn't really do. I didn't find it had any opioid relief at all, and frankly, I don't even consider it an opioid. I don't really understand why it's called an opioid. And we looked up.
It isn't actually an opioid. It's a partly synthetic opioid.
Yeah, semi-synthetic opioid. And methadone is a fully synthetic opioid, and I know methadone very well, and it's very powerful, very toxic, and very strong, and very hard to get off. But I wouldn't put. I would absolutely say it's fully synthetic because it works just like heroin and morphine works. Buprenorphine, on the other hand, is a completely different drug. It's supposed to have opioid effects, analgesic effects, but that may well be the case, but it certainly blocks the receptors to opioids. And looking in our research, you know, a lot of confusion. Some people even think that naloxone and Suboxone are the same thing. Well, Suboxone is a brand name for buprenorphine. Buprenorphine is the drug name. And one of the brand names, which is Subutex, another one is Suboxone. Now, just because Suboxone sounds like naltrexone doesn't mean they're the same thing. Okay, they're completely different drugs, and we've researched that. However, if people think naloxone, the chemicals and the drugs that go into naloxone might also be in buprenorphine, then I'd very much like to hear from you if you're a healthcare professional or a pharmacist that really has had the medical training needed. Yeah, people regurgitating Wikipedia, which is also wrong, we found out. Martin, our researcher and creative director, has looked this up, and he's like, I don't want to put him on the spot here because I know he likes to stay back camera. I mean, do you want to go there, Ryan? Go on.
Yeah, so he was just able to confirm that, you know, it's not right. Wikipedia is wrong, and it's wrong according to the BNF website and NICE. So those will be will be in the links below, so you can do your own research and find out for yourself. We've tried to do that, and
But it's hard to
you
do
know,
your own research when people rely on Wikipedia and Wikipedia is wrong. I mean, I've used Wikipedia and I trust it in some ways, but on technical questions like this, I don't. And I'm right not to, because doing my research with other people as well. And Martin put me onto this. You know, yes, it's a semi-synthetic opioid. Okay.
yeah, yeah.
So that's a very different to a fully synthetic. Well, I don't really understand that. I'd love to learn a bit more about that.
Yeah, and
Uh,
we will also manage to contact, you know, two healthcare
Get this out
professionals.
of my head. Can I just get so it says it's an opioid on Wikipedia, which is not correct. It's a semi-synthetic opioid.
Yeah, no, I mean, I think I just want to make it clear that we're not giving advice. And please, why would you think that? We're asking the question.
I think we're giving it.
We're asking the question from healthcare professionals
Yeah.
because the information online definitely isn't consistent. Wikipedia doesn't agree with the BNF website or NICE's website to do with buprenorphine, aka Subutex. And on there, which we can put in the link and we'll highlight it, anything over 8 milligrams of buprenorphine has an effect on the receptors for opioid medication. And that was actually one of our researchers that came to try and help us. And she's a studying nurse at the moment, so she's really clever and smart, you know, getting onto these type of subjects, and she's been really helpful, and that's what we wanted. She's actually been able to answer some of the 8 questions I had. So I don't want to feel like we're misleading anyone. That's never the intention. We wouldn't do that. And if for anyone to think that we would do that, I'd be, you know, concerned about. Please, you know, if you feel that way, contact us and I'll put you at comfort. What we're trying to do is find out more information to try and
Can I just say the advice she gave you, the really important advice she gave you, which was anything over 8 milligrams, and she showed the screenshot of her page where they're trained this, anything over 8 milligrams of buprenorphine in the patches shouldn't be done if the patient's on other opioids.
Yeah, that's what it said on the NICE guideline. Yeah, NICE website.
Yeah, LinkedIn's NICE. Yeah. Okay. So I just had to get it was in my head, Ryan. I was desperately trying not to forget that as you were talking.
Yeah, no, obviously we wanted to, you know, there was confusion on the video, and it sparked some
confusion. There wasn't confusion. I don't think there was confusion.
No, not from our point of view, but some people took it the wrong way, and we need to just set that expectation that we are not giving advice. Dom in the first message and in the first video rather said, you know, if you're on buprenorphine, you should talk to your GP about it 100%. and the effects of opioids working with buprenorphine, aka Subutex. So Subutex
is the brand name of buprenorphine, so we really should be using the drug name.
Yeah, just buprenorphine. Yeah, buprenorphine. That is the right word, and it does have blockers in there. There's 2 particular words. One is antagonist, and the other one is sorry,
agonist and antagonist.
Yeah, agonist and antagonist, and both of those words are linked in with buprenorphine.
All those details, all those really technical details that as patients we should probably just put the links to the website. I think is best.
The BNF website will be in the link below, and you please do your own research and enjoy the video. You know, we never set out to upset anybody. We set out to try and understand what was confusing to us. That's it. So
and we wanted to make sure that no other pain patients were treated as addicts without them even knowing about it, because to me that's what seems to be happening. I know my doctor wouldn't dream of coming up to me and saying, Dom, I want to put you on buprenorphine, because he knows what I would say to him. I'd be like, are you mad? That's going to stop my opioids from working 100% effectively, because it would.
It would, yeah.
A low dose of opioids, it might be a safe. There is no. I don't know what the research is. Please send us the research. Is there anyone that But even if there is research on this, it's wholly unethical to put a patient on a drug because you think they're going to experience euphoria and they might get addicted, or you think they're addicted. If you think a patient is addicted to opioids, you need to just have that discussion with the patient first and then agree a course and explain the buprenorphine or any drug you're going to give them, what it does and what it is. That hasn't happened with you, Ryan. You were told that it was a painkiller and that it was fine to take with all your other opioids. And I won't go into it, but you're on a lot, aren't you?
Yeah, yeah. So more oral morphine and dihydrocodone, maximum. So yeah, I mean, I don't want to, you know, we've made the first video, which kind of it talks about that. I just want this intro from us now. This is the update. This is a response to questions and feedback we got to let you guys know we're not giving advice. Our intention was, you know, for healthcare professionals to come back with the right information because we were asking for that. We, you know, we're under, certainly now, from looking at the BNF website, having spoken to a pharmacist today and a nurse, and carrying out further research, it does, you know, all point towards
everything we said in the first video, which I'm really pleased to see, because I knew in the first video we made no claims at all.
It's a long video, but it's a long video for a reason. It's quite a lot of information, you know. So sorry to those people that, you know, haven't got the patience to watch through it all. There's nothing I can do about that. Sorry about it. You know, give it a thumbs down if you don't like it.
Okay, welcome to Dark Jedi. I'm Dom Stenning, and we're talking to Ryan Holmwood, and he's going to talk a bit about something which we've been talking about today. We haven't gone too in depth, but it was quite shocking, and we kind of feel this needs to be put out there. We'd like to hear from patients. We'd like to hear from healthcare professionals on this probably quite a controversial subject. And people need to know, as in my video with Steve Turner, he's a registered nurse, but he also teaches, and he teaches duty of candor, being honest at all times, and prescribing, his involvement in prescribing, which was really interesting, and how it's so important that the prescribing, not, you know, shared decision making often doesn't happen, which you're going to hear about here, and that's why it needs to be patient-led prescribing. I'm not sure whether Steve used that exact term, but that's the term I quite like, and I think that's where we've got to go, patient-led prescribing. We're sovereign adults, and we should decide what goes into our bodies, as long as we're told all the risks, of course, and our lives aren't chaotic and out of control. That means you've slipped into addiction if that happens. So Ryan, you ready to go? Do you want to start us off? And
yeah, so hi, I'm Ryan Holmwood. Yeah, I'm co-founder of Medical Cannabis UK, joint CEO, and we established that in February this year, and it's slowly grown into a nice group of people. My background is that last 6 years I had an injury at work. I've not been able to work since then, and I've been on 48 different tablets, 13 different prescriptions, a patch that I used to wear on my arm called Buprenorphine, Butex 15, and taking oral morphine on top of that. So between 5 and 50 mil of that a day. And that's,
and you were on 20 micrograms, weren't you, of buprenorphine?
Yeah, I started on 20, yeah. Yeah.
How much Oromorph and or other opioid-based medications were you on at that time, and what doses roughly?
So the other two opioids that I was on, which I thought or felt contributed to my pain, like my helping my pain, was dihydrocodone. That was the main one, and at the time it was the 40 milligram tablet. So I'd take 2 of those 3 times a day. They were slow release capsules, so they were longer lasting. Unfortunately, for some reason, they're just not available anymore. So I'm on 2 times 30 tablets 4 times a day. and the other one would be oral morphine, which is a liquid.
Okay. Yeah, I mean, I know dihydrocodeine very well. I've been on that for many years, and actually on the same dose you were on before it was suddenly stopped against my wishes, but that's another topic for another day. So yeah, we had a chat earlier, didn't we? And I was really worried about you because you were in absolute agony, and yet you were on dihydrocodeine, you know, and you had your Oromorph as well. And I was very surprised. You said to me about the buprenorphine, and I knew about buprenorphine. I was pretty sure it was the same as Subutex, but not too sure. But I looked into it, and it is. It's exactly the same things. The trade name of buprenorphine is Subutex. And if you've been an addict on heroin or coming off methadone, you'll know Subutex very well, and you'll know that you cannot take opioids or synthetic opioids like methadone with Subutex because it's a blocker and it blocks the dopamine receptor in the brain. It's supposed to allow some through. I don't quite work how that quite happens, as it's a blocker and it's meant to work at the same time. To be honest, my personal experience and the experience you're going to hear from Ryan tells me that this is a blocker. It doesn't, it has little or no analgesic effect, and it certainly will block any, you know, the dihydrocodeine and the Oromorph will not be working effectively because the dopamine receptor is being blocked. And I explained this to you, didn't I, earlier on? And you were pretty shocked and upset.
Yeah, to be fair, it was a bit of a surprise. I thought from, you know, I trust my doctors, particularly my pain consultant in, you know, my local area, whom is I'm under his care, and I trust them to medicate me with the appropriate medication for my symptoms. So I didn't, you know, I'm not a doctor. I get told what I'm given, and that's it. So I used to wear a patch every day for 7 days, and then replace it with another one for 7 days, and that's the whole cycle. You wear one for 7 days. And I thought it was, the way it was explained to me, that I was told it was a like a foundation of pain relief, which would be, you know, constant in the bloodline. So in other words, with tablets you have a spike and then it drops. This is something that will be more stable and create a sort of a line of pain where, you know, is acceptable. But yeah, I found out today that that's not quite been the case, and realized why I have been struggling for the last 5.5 years, taking all these tablets that I do.
Yeah, and the other thing was that buprenorphine, or Subutex as it should be known, that could be quite toxic to your liver and kidney. So if you can avoid taking it, it makes sense to, but to have it with opioids is just not done. Or certainly that's beyond my understanding of pharmaceuticals, and I've quite a deep understanding from personal experience and from growing up in a medical family.
So because you've touched on the liver, just so I remember, my liver function tests for the last 4 years have been in the 450s, and I'm 38 years old. They should be no more than 56.
Wow.
So, you know, I'm 8 times the normal limit, and my doctors asked me if I drink alcohol as a result of receiving my you know, my results. I asked them if they well, I won't, you know, I said no because I didn't drink alcohol, because I was taking 48 tablets, so, you know, you obviously not a good mix. Yeah, so for 4 years, in 2017 I was diagnosed with a fatty liver. So some scarring. Apparently there was no cirrhosis, but you know, 2017 was 4 years ago, and I haven't been checked since.
Well, I would hope so. You wouldn't have sclerosis because you know, you're not a heavy drinker, and well, you don't drink for the last how many years? Yeah. It's all since you've been on it. So you're doing all the right things, and they're asking about alcohol when really they should be asking, well, what should we be prescribing buprenorphine, aka Subutex, to somebody who's already on, you know, a substantial amount of opiates? And the really shocking thing that I found out looking up, I don't think I've told you this yet. The real shocking thing is I looked up on, well, first of all, I looked up on the NHS website. It had buprenorphine, and I looked through, and it neglected to say a lot of things, but it did say its trade name is Subutex. But when I looked up Subutex on the NHS website, no result found. So
right.
why are they not explaining what Subutex is? But if you go to the drugs charity, and I went to the release website, and they were very clear that you cannot have opioids with Subutex. You've got to be on minimum amounts of opioids or synthetic opioids like heroin or methadone, and that's my experience. Is you cannot take Subutex really with opioids. It defeats the whole point of doing it.
Yeah, so from what I've read today, and obviously from your wealth of knowledge in the medicines that you've used yourself, and the reading that you've done, you're able to explain to me that it's counteractive. So I'm wearing a patch that is counteracting the benefits of dihydrocodeine and morphine. Also benzodiazepams, things like diazepam, which I take. It was never really, I've had pneumonia, so I've got a damaged right lung. Obviously coronavirus is here, so that's also scary. But what was worrying is something that I found out today as well, that taking diazepam on this medication, you're meant to be really carefully evaluated and checked. I understand, I've been taking it for a long time, but at no point has anyone said if your breathing goes dull, or if you have problems breathing, or it might cause breathing problems. That was another big sort of issue for me. So when I found that out today, that I'm taking tablets that aren't doing anything, I'm taking liquid morphine that isn't doing anything, and then I'm taking diazepam, which puts my lungs at risk from being able to breathe, particularly at night if I'm going to bed. The whole thing was a bit overwhelming, to be honest.
Yeah, I know it was, and I know, it was quite a big deal finding out, and that's why we're doing this video a bit hastily, but we're here doing the video, and we've got my creative director and videographer, Martin Winfield, who's been excellent and dropped everything he's got to do to make sure we can get this done properly and professionally today. Can
I jump in on that, Dom? Thank you as well to Martin for doing this today. Big shout out to Martin for all the hard work he's done for us in the past, and for the work that we've got lined up for him to do in the future. We're gonna keep really pleased.
He's blushing now. So I wouldn't worry too much about the benzodiazepines as far as the buprenorphine goes. It's mainly a dopamine blocker, so the dopamine.
I mean, I don't want the focus to be on the breathing. The focus is that I've been taking 8 tablets a day, and say as an average, say 20 mil of morphine a day for 5 years, and it hasn't helped me. It's just toxic. All it's done is made.
Yeah, you're on Subutex, a blocker, so that's why your morphine hasn't been helping you, and that's why I was so shocked to see you in so much pain. And I was thinking, well, why isn't the Oromorph working? Why, that's a Oromorph it's 10 milligrams per 5 mil, so that's powerful Oromorph.
Yeah,
and that combined with the dihydrocodeine as well, I couldn't understand why you're in so much pain. And then when I found out about the buprenorphine and I looked it up, and then I realized that yes, it definitely was Subutex. I couldn't believe it, and I couldn't believe that you've seen how many pain specialists?
4
pain specialists and 2 GPs who have looked over your prescription in detail, haven't they?
2 separate GP practices, over the last
GP practices. That's in the NHS. You've had 4 pain specialists, one of which is private Harley Street.
Well, actually 3 private Harley Street, 1 NHS consultant, pain consultant.
Right. So 3 private pain specialists mix this, who you pay a lot of money to see, and you expect to get the best treatment possible. 1 NHS pain consultant, and two NHS GPs have missed this, and we may be wrong. Who knows? You know, we're not the doctors, are we? But I'd love any doctors, healthcare professionals out there to comment and help us try and understand what's going on here. And if this is deliberate, which it's hard to not believe it is because of this war on opioids for pain patients like us. I mean, I've had my script cut in half. Against my will, I didn't want it cut in half, and so is my mother, and that's why I'm on medical cannabis, because I'm struggling with my pain.
So I've been sorry, I just wanted, because before we talk about medical cannabis, like just going back to prescribed medication from, you know, doctors that you see on the NHS, for example, me, and this particular reason, the reason I'm doing this video is for awareness, because I was unaware. And I've been taking tablets that haven't contributed to my pain relief for 5.5 years. So that's 8 tablets a day times 5.5 years. That certainly weren't doing anything for me other than poisoning my body and my damaging my liver. That's why I'm upset today. That is
a bit like driving the car with the handbrake on, isn't it? For 5 years.
Yeah, it's a good analogy. Yeah. So if you know, why is the car not moving? Because you've got a handbrake on. That's a great analogy.
Yeah, and that's the one that's the Subutex blocking the dopamine receptor. So any opioids you're taking, all the dopamine is being blocked. So
yeah, I'd love to hear back from any healthcare professionals to put me, perhaps put my mind at rest and say, no, that's not right. But from everything that I've seen and read online from people that are doctors, and, you know, will all this be in the video, the links for the, so
make sure we put them on the description in YouTube so people will have all the necessary links. And Martin will add things in as well. So people watching this right now will probably already looking at right now as I speak, just below me down here somewhere. They'll be reading the articles that we're talking about.
I also, just out of curiosity, because I have a box here, right here. Okay. I pulled out the information. I pulled out the instructions.
Okay.
And I've read it, and it says, do not use for acute pain. I do have acute pain in my lumbar spine, so that's one confusing thing in the instructions. And well, the rest we've spoke about already, but even in the instructions,
on the release drugs on release website, that organization there, release, they said you shouldn't be on pain, you know, shouldn't be given for pain or chronic pain. So it's not just chronic pain, even quite, you know, severe pain.
It says on the instructions here, it's acute as opposed to chronic. So to be quite honest, it's difficult to differentiate the two, because you can have acute pain in more places than one. So, you know, my pain is acute at the base of my spine, and that's where it hurts. However, obviously, as a it's a bit complex, but as a problem because of my nerves and my discs, the way that they're not sort of in the right places anymore, it creates pain elsewhere in my body. So my right leg, sciatic nerve issues, you know, my upper body, I have issues now, and even standing straight is difficult.
Yeah, I think this is what people, unless they've had it, they don't understand. I mean, I myself, you're very similar to me. I mean, I can't stand for more than a couple of minutes. I mean, the other day I was celebrating because I managed to stand for 3 minutes unaided, which I've never done, not done in years, since it's the medical cannabis that helped me there. You know, and I think this has come to light because you have gone for medical cannabis and it's got you reassessing all your meds, but unfortunately the doctors didn't pick up on it. I'm gutted they didn't, but thank goodness through this journey we have, and hopefully we can raise more awareness and make sure that patients don't just trust their doctors and just do whatever the doctor says, that they need to do their own research too. It shouldn't be that way, but it's
I wouldn't want to go probably as far as to say don't trust your doctor. I think it's just
I'm
perhaps
not saying don't trust your doctor. Can I just clarify that? It's really important to clarify that. I'm not saying don't trust your doctor. I'm saying that your doctor is human and the doctors can make mistakes. They can miss things. So it's really important that us patients,
check
no
everything.
matter who we are, whether we're in health or wherever, we need to check our scripts. We need to make sure we have access to our medical records and make sure we ask questions. Why am I on this? Why? And read the instructions, you know, give it a quick look online, you know. But I think a lot of people are going to be in a similar situation to you, Ryan, because I don't think this is a mistake. I really don't. I just don't see how it can be a mistake. And I think buprenorphine, I think it's the way Subutex is taken off the NHS websites, you can't even search it, even though they say buprenorphine is Subutex. I don't understand that. There's a lot of things that don't make sense about this at all. And I think we're going to find a lot of people on buprenorphine who are being treated as drug addicts instead of pain patients. And I've seen this happen. I've heard it from so many people now who have had their opioids completely cut with no replacement.
Yeah, I would be really, really angry if my doctors were treating me like a drug abuser or something like that. I mean, I just follow what I'm told. So I get a prescription. On the box, it tells you what you should do and how to do it. And that's what I've been doing for 5.5 years, not realizing that my dihydrocodone and morphine were being possibly blocked by this buprenorphine patch.
And what were you told by the doctors that prescribed the buprenorphine? What were you told? What was this? What was it meant to be to you?
So, in a nutshell, a baseline for pain relief. To, you know, so you have a constant line of relief throughout the day, night, etc. So I thought it was really good.
So did they explain anything at all about what else it did as far as blocking the receptors? No, nothing, nothing at all, not even a hint.
No, just said it's a good baseline for pain.
And how many doctors have you discussed the buprenorphine with over the 5.5 years?
So only, I'll be quite honest, only my NHS doctor and my NHS doctors, nurses, they're specialist pain nurses. That's it.
They should know this then. So I think there's something going on with the training here. There's something not right, and there's something that definitely needs sorting out. They might not know, because I've looked on Wikipedia, and if you look on Wikipedia for buprenorphine, it's not correct. It doesn't say what it really does. And that's because Wikipedia isn't like the encyclopedias used to be. And my fear is that doctors and nurses don't realize that. They use Wikipedia and think that they're prescribing something that isn't as advertised.
Yeah. Yeah, I mean, this is like I say, it's all come to light today. And if it does turn out that, you know, it has blocked any benefits that I may have had from the medication. So in other words, I've suffered in pain because it's been blocked because of the patch. I'm not going to be particularly happy about that, because I've been in some terrible scenarios that have brought me to tears in pain.
No, and that's no joke. Unbearable pain. There's nothing worse than unbearable pain. You know, if you've had kidney stones, you had some experience like, just imagine that going on forever for 5.5 years. And then you find out after 5.5 years, the opioids that you were taking that you didn't really want to take, that your opioids were taking, instead of them working, they're not working effectively at all. They're doing something, but very tiny amount, because those dopamine receptors that are so important that help with the pain are being blocked. I mean, it's bonkers, absolutely bonkers to me. I mean, I'm not a doctor, so.
And the damage to my liver on top of that.
Exactly. And it makes sense to both me and you after looking it up and doing our research. So why isn't it making sense to healthcare professionals?
Well, hopefully, you know, this video will be put out there and we can get some answers. But we're really, you know, we really want people to be informed, and we like to be informed. So, you know, it's an open book. Come in, comment, and let us know, guys. We'd really appreciate your help if you can.
Yeah, so please, healthcare professionals, make sure you share this with your colleagues if you don't know the answer or if you're unsure. we want answers. We don't know what's going on, and we'd love the answers. We really would like to get to the bottom of this. And I suspect there's a lot of patients like Ryan that are on buprenorphine and other opioids that shouldn't be mixed together. I'm hoping that, I don't want people to panic. Ryan's managed for 5.5 years okay. Yeah, his liver's not brilliant. But you know, you've been in you're a rock in a hard place. You don't have much choice when you're in pain, and the pain's that bad that you're thinking about ending your life. You know, you
When the
need
pain's that bad, you don't think about anything logically, and you listen to the doctor. You take all of the tablets they give you.
Mm.
I mean, you know, 48 tablets a day. It's a lot of tablets. I don't know. Every time I tell someone that I've ever, you know, spoke to that I used to be on 48 tablets a day. You know, they even find it hard to believe until I show them my prescription, and then they realize that I'm not lying. So yeah, it's a tough pill to swallow to find out that, you know, I may have been taking these additional tablets, but this patch has stopped them working as they should. So in other words, it was pointless me taking them in the first place and putting
to my mind, yeah, to my mind, you the last 5.5 years you've been experiencing pain you didn't need to. If you weren't taking the buprenorphine, your opioids would have been so much more effective. And this is what I don't understand. It makes no sense.
Yeah.
So yeah, let's close that up. I don't know how long it was, but it went quickly. I hope everybody enjoyed it. As we said, like, share, and subscribe, and let's see whether we can get to the bottom of this. If you're on buprenorphine and you're also on opioids, you need to go and see your doctor straight away and say what is going on. You really do, and check out the links below. Okay, that's us done.
Brilliant.
I think.
Thanks, guys.
Great. Take care, everyone. Bye bye.